Hi, this is Cheryl Gallant, your Conservative Member of Parliament for the life-affirming riding of Renfrew-Nipissing-Pembroke. Canadians need to have a real conversation about medical assistance in dying, assisted suicide, and euthanasia. This is a difficult and emotional issue. In our current age of clickbait journalism and algorithm-fueled social media, this type of conversation is especially challenging. When the Supreme Court of Canada reversed its previous legal precedent on assisted suicide, many Canadians were deeply alarmed. In its decision, the court allowed for an individual to receive a medically assisted death if the person was experiencing intolerable suffering and untreatable, and dying was in the reasonably foreseeable future. Under those specific conditions, polling indicated that a majority of Canadians did approve of overturning a legal precedent. In the ruling, the Supreme Court dismissed concerns that overturning the precedent could lead to a slippery slope. Instead of a slippery slope, we got an industrial water slide. A Quebec court ruled that the specific condition of death being reasonably foreseeable was unconstitutional and opened the floodgates. Justin Trudeau had a choice. He could have appealed the decision to the Supreme Court, but he didn't. Instead, Trudeau changed the law to remove the reasonable foreseeable clause. But that wasn't the only change he made. Trudeau also expanded the law to include mental illness as an intolerable, incurable condition. The Liberals and their allies even want to allow children to make the decision. Since Trudeau loosened the rules, Canadians dying at the hands of the state has increased dramatically. The number of Canadians who received medically assisted death increased 32% last year over the previous year. More Canadians last year died from medically assisted death than died from opium drug overdoses. Even more alarming than the increasing numbers of Canadians seeking medically assisted death is the increasing number of Canadians who are not seeking death, yet feel pressured into killing themselves. Recently, the international news service Associated Press reported how one man began to secretly record his conversations with hospital staff after they repeatedly encouraged him to consider medically assisted death. They even told him how much money he would save the healthcare system if he allowed himself to be killed. Last week, Global News broke a story of a veteran who was seeking help from Veterans Affairs when he was encouraged to consider seeking a medically assisted death. We've also heard the story of how a BC family brought a mentally ill member to the hospital to be treated, only to learn after the fact that their loved one had received a medically assisted death. The RCMP are investigating the BC case, but these cases I just mentioned should all be looked at. It's still a crime to counsel or encourage suicide. There are exemptions for medical professionals when explicitly discussing medically assisted death, but nowhere does it grant exemptions to Veterans Affairs bureaucrats or hospital administrators. Under the law Trudeau passed, Parliament is required to review the Act every 5 years. It's been 6 years now, and the Liberals still refuse to proceed with the review. It's clear from just the few reports of people privileged enough to have the ear of the media that there's a serious problem with Canada's laws. The safeguards have been cast aside. More Canadians are completely unaware of what's happening until it's too late, until they get the call from the morgue to find out a loved one has committed suicide. Many of us Canadians living with elderly parents are worried about people like that hospital administrator who mentions the cost of a hospital bed while handing your loved one a brochure on assisted suicide. Worried about people like that Veterans Affairs bureaucrat whose suggestion of assisted suicide actually harmed the mental health of a wounded in combat Canadian veteran. Canadians living with their disabilities and their loved ones are also worried. A team of United Nations special rapporteurs warned that Canada's medical assistance in dying law posed dire threats to our elderly and infirm populations. Quote, "There is a grave concern that if assisted dying is made available to all persons with a health condition or impairment, a social assumption might follow or be subtly reinforced that it's better to be dead than to live with a disability." End quote. The report from the United Nations is over a year old. These recent reports of Canadians being pressured into seeking assisted suicide only confirms the concerns in the report. Canadians are compassionate. Nobody wishes for a loved one to suffer intolerable pain. But by expanding medically assisted death to include anyone suffering any discomfort, the Liberals have weakened the safeguards. An aging population, a strained healthcare system, and easy-to-access assisted suicide pose a real threat to the vulnerable populations. It's time for Parliament to review the law and restore the safeguards. If you or someone you know has felt pressure to seek assisted suicide, please contact me. Canadians need to hear these stories. Live from Ottawa, this is Cheryl Gallant.